So let's go over the Affordable Care Act marketplace, aka Obamacare health insurance. Let's go over the basics. My name is Ed Weir. I am a retired district manager of the Social Security Administration. Before that, Department of Welfare. Before that, a veteran and sergeant in the Marine Corps. So I am essentially, I guess, the leading expert on all government benefits in the country based on my decades of inside experience. And I help people throughout the country with all things Social Security, Medicare, the Affordable Care Act. And my unique service is, again, always free. One of the services I provide that essentially nobody else can is that I can help you with the Affordable Care Act health insurance before your Medicare begins. And then when you switch to Medicare, I can help you with that as well. And in between, everything Social Security related, helping you plan for retirement, looking to file for disability. Sure, you share this video and with your friends and family. Let's make sure they're receiving everything they're entitled to. All right. So the Affordable Care Act marketplace. One of the things important about the marketplace health insurance is that you cannot be denied because of pre-existing conditions, nor can you be charged more for pre-existing conditions. And all marketplace plans provide 10 essential services. Ambulatory patient services, outpatient care you get without being admitted to a hospital. They cover emergency services, hospitalization like surgery and overnight stays, pregnancy, maternity, newborn care, mental health and substance use disorder services, prescription drugs, rehabilitative services and devices, laboratory services, preventive and wellness services, and pediatric services. Some companies offer extra services above and beyond that. And you can also choose to add on other services like dental and vision. All the plans are broken down into what's called metal tiers. So there's bronze, silver, gold, and platinum. And these don't necessarily dictate or identify the quality of the particular plans in terms of benefits. It just talks about the cost sharing of each particular metal tier. So for each metal tier, for instance, bronze, the carrier that you choose will pay 60% of covered medical expenses, and you will pay 40. For a silver, the carrier will pay 70, you will pay 30. Gold, but obviously when the company covers more, the premium is going to be more as well for your monthly premium to get that extra coverage, that extra co-insurance for the company to pay, your monthly premium will increase. So it's important that you find a particular plan in your area. All these plans are dictated by the particular area, and how you find a plan that serves you the best. Get a list of your doctors and then your prescriptions, and you find out which plan in your particular area covers all the doctors you want to continue seeing and which plan covers all of the prescriptions and at the best price for your prescriptions. And then from there, you narrow it down in terms of total price. Needless to say, you can buy any of these health insurance plans essentially off market. That is, go directly to the insurance company and you don't have to deal with the marketplace or Obamacare or whatever the case may be. But if you do that, then you will not receive what's called the premium tax credits or the cost sharing. So the premium tax credits is basically assistance from the government, essentially subsidies to pay for your health insurance. So if you give us a call or if you use a local broker, someone that's authorized to enroll you in a plan in your particular area, and we are licensed throughout the country. We help people throughout the country with the Affordable Care Act. And what we will do is ask you a bunch of questions about your income, your foreseeable income for this year and next year, depending on when we're going to roll you. We check your doctors, we check your prescriptions and everything. And then we say, okay, based on your income, your projected income going forward, this is how much of premium tax credits you will receive. And these are advanced premium tax credits. So it's important that your estimate of your income going forward is correct. And that will dictate how much the government will subsidize your particular health insurance on a monthly basis. So, for instance, if your health insurance is $500 and the government will subsidize $400 of that, then you only have to pay $100 a month. And we can do all those calculations for you. Some type of income is covered, other types of income are not covered. So it's important that you estimate correctly, because if you don't, then you might not get all the benefits you're entitled to. Or on the other side, you might have to pay that money back once you do your taxes the following year. So it's a very, very important that you get the estimates correct, and we can help you make sure those estimates are correct based on all of the rules and regulations of the Affordable Care Act. And there's also cost sharing as well. And those are limited to silver plans. So not the bronze, not the platinum, but to the silver plan. So if you pick the silver plan, um, then you might have extra benefits available to you, called cost sharing. And it's basically in terms of deductible and co-insurance. um, the government will pick up other benefits above and beyond the premium itself. So if you are eligible for those, you and your family, you must pick the silver plan in order to be entitled to that. So some people say, well, I'd rather have the platinum plan because it covers more. Well, actually, in your particular situation, because you're also going to get the cost sharing, the silver plan actually will cover more because of those cost sharing. So it's important you pick the correct plan the first time, and that way anything happens, you will be covered. So again, give us a call, and also we can help you with Medicare when that time comes. You and your family, make sure you're on track to get your Social Security retirement. If you're looking for disability full service, give us a call and we can help you out. Have a beautiful day.